Hi, my name is Darius Hardy, and the purpose of this video is to provide nurses a more in-depth knowledge about asthma. Asthma is a chronic respiratory disease which is caused by inflammation and narrowing of the airway, making it harder to breathe. The objective of this presentation is to explore asthma, including the impact on the population, etiology and risk factors, pathophysiology, clinical manifestations and complications, treatments, and nursing evidence-based practice. Asthma is a very commonly found respiratory disease. It was found more than 27 million people in the U.S. have been diagnosed with asthma. In 2021, it was found that 25 million people were currently living with asthma. Over the years, it has been shown that 1 in 12 people are newly diagnosed with asthma, and it has accounted for 3,517 total deaths in 2021. In Figure 1, the graph relates all gender, age, and race of people currently diagnosed with asthma in 2021. Asthma has been shown to cost $81.9 billion nationwide, including to cost $3,266 annually per person in 2019, and an average of $5,000 per hospitalization in 2021. Asthma is mainly found to be genetically passed down to the offspring through DNA. Parents who are diagnosed with asthma, or if one parent is diagnosed, can potentially have a child who develops asthma. Risk factors include environmental risk factors such as working around chemical irritants and smoking. Also, having relatives with asthma can increase a person's chance of developing asthma. Lastly, having other allergies such as dust or pollen can make a patient more prone to develop asthma. Asthma can start off by being initiated by IgE antibodies that are then synthesized and released by plasma cells. These antibodies respond to certain triggers and then bind to different cells, which in return contract smooth muscle and cause airway tightening. Helper T cells localize to the lungs, which perform bronchoconstriction and cause inflammation. During asthma exacerbations, goblet cells and submucosal glands produce extra mucus to clear the airways. As you can see in Figure 2, normal lungs have no mucus production and the airway is clear. Likewise with asthma, extra mucus is produced to clear toxins, causing a more narrowed airway. Asthma usually starts in early childhood where symptoms are the worst and can start to improve in adulthood. An early sign of asthma includes onset of cough. Some common manifestations of asthma include difficulty breathing, chest tightness, increased mucus, and wheezing. Wheezing is a hallmark sign of asthma and is a high-pitched whistling sound made when breathing in or out. Wheezing is usually caused by the narrowing of the airway. The most fatal complication of asthma can be if the airway is so narrow that the patient cannot get air in or out of lungs. Asthma is mainly treated with medications and supportive care. Medications that treat asthma include bronchodilators, steroids, and anti-inflammatories. Bronchodilators help treat asthma by relaxing smooth muscle in the lungs. Steroids and anti-inflammatory medications help reduce swelling and inflammation in the airway, making it easier to breathe. One procedure used to treat asthma is called a bronchothermoplasty. The procedure uses heat to shrink the smooth muscle in the lungs so they can't tighten and cause airway constriction. Other treatments include providing supplemental oxygen during asthma exacerbations. An article titled Asthma Management in the Nursing Journal of Clinical Excellence, written by author Galantine in 2022, provides more details on how to manage asthma symptoms. The article summarized on how asthma can be managed by medications such as bronchodilators and steroids. Also, the article explains preventing asthma attacks by avoiding triggers and allergens. Some nursing recommendations discussed in the article include obtaining the patient's allergies to educate the patient on what can be a trigger. Also providing a specific medication regimen for the patient to follow daily. Also ensuring that the patient is getting adequate rest and fluids to decrease symptoms. The remaining slides provide the sources of information used for this video.